Yet another negative pregnancy test. But how come? You have all the signs that you are pregnant. In fact, the last time you were pregnant, or for those of you who have never been pregnant, you've spoken to your friend who's told you all the signs that you're experiencing are indeed signs that you are pregnant. But test after test show that you are not pregnant. What is happening? If you want to know why you may be experiencing multiple pregnancy symptoms, but yet you're getting negative pregnancy tests, keep watching. Hi guys, welcome to Hey Doc with me, Dr. Kady. I'm a board certified family clinician. On Hey Doc, I talk all things around women's health, fertility medicine, and all pregnancy related issues. If you like this kind of content, do subscribe, share, and like. So as I alluded to in the intro, getting negative pregnancy tests whilst you have multiple pregnancy-like symptoms is very common. And if you have been experiencing that, trust me, you are not alone. It is not only frustrating, confusing, but darn right stressful, particularly if you are a woman who has undergone fertility treatment in order to fall pregnant and you have spent all this money doing IVF or any other type of fertility treatment and you are still getting negative pregnancy test results. So let's break it down and consider what may actually be going on in your body when this happens. So before we go on, we want to make sure that we're all on the same level, right? So there's no point in me talking about pregnancy symptoms. So when some of you watching me may be pregnant for the very first time and you don't really know what to expect, apart from the stuff that you've watched on social media or what your friends have said, you've never really sat down to speak to a medical professional about what you should expect at the early stages of pregnancy. What are those symptoms supposed to be like? Here are common early pregnancy symptoms that you should be expecting to see anytime between week 1 to week 12 of gestation. This list of symptoms is in no particular order of occurrence. So not everyone is going to be experiencing all of these symptoms, and you're not going to get symptom 1, then symptom 2, then symptom 3. It can happen in any random order. But of course, we will start with the most obvious, which is a missed period. This is one of the most noticeable signs. Then we have nausea and vomiting, often referred to as morning sickness. But in actual fact, this symptom of pregnancy can happen any time of the day. Breast tenderness and breast swelling, which occur due to hormonal changes which make the breasts more sensitive to touch. We of course have the debilitating fatigue that some women experience in their pregnancy, where you can find a woman who sleeps unusually excessively. For some women, that is how they have been found out to be pregnant. They just sleep loads, and that has been linked to the progesterone hormone, which is higher at the early stages of pregnancy. And progesterone can lead to fatigue. Frequent urination. The woman will experience an increase in urine output. It's not the type of urinary frequency that you experience when you have a urinary tract infection. Usually with a urinary tract infection, there is pain, but with frequent urination that happens as an early sign of pregnancy, the hormonal shift and increased blood flow to the kidneys lead to more urine being produced. And because the bladder has a specific capacity, then the woman will continuously be producing more urine. So you're not passing small amounts of urine, you're passing decent amount of urine each time you go. Hormonal fluctuations are to blame for the mood swings that some women experience during the early stages of pregnancy. We have food craving or food aversion. Bloating happens in some women because the pregnancy hormone actually slows down the rate of digestion. As the uterus starts to stretch and grow, some women will describe mild lower abdominal cramping or just subtle period pain-like cramps in their lower abdomen. For some, they will also have some vaginal spotting, which can be due to implantation bleeding or a perigestational hematoma, which is essentially a small sac of blood that is sitting within the uterus close to where the baby is growing. And finally, I think I have exhausted all of the possible symptoms that you could be experiencing in early pregnancy, an increased sense of smell. But here's the thing, ladies, these symptoms aren't exclusive to pregnancy. Do we all agree? That's right. Premenstrual syndrome can cause nearly all of these symptoms. So can stress, and so can ovulation. Okay, let's say you've experienced multiple of these symptoms and you really are convinced that you are pregnant, and you take a pregnancy test and it's negative. Let me dig into the reasons why that might be. The most common reason is that most women are so eager to fall pregnant. They just cannot wait to see those two prominent line and to celebrate with their family. But the anticipation for that positive result may result in them testing too early. So here's the thing. Your pregnancy test is going to be negative if it is done too early. Why? This is because your body will not have produced enough of the hormone called beta-HCG for it to be detectable in the urine in order for the pregnancy test to be able to detect that hormone. If that hormone is not present in the urine simply because you took the test too early, it is obviously going to be negative. So how does it all work? So after fertilization happens, the embryo will travel down the uterus and implant itself into the endometrium. This usually tends to happen 6 to 10 days after ovulation has happened. Once implantation occurs, the body starts to make the hormone called beta-HCG. But here's the thing, even though that is the hormone that the urine pregnancy test is looking to detect, it will take a few days before the beta-HCG level rises to a high enough level for it to be detected in the urine. So ladies, timing is everything. Testing before implantation happens is obviously not going to give you a positive pregnancy test. And we usually see that in ladies who are, once again, really eager to get pregnant. So for those of you who are going through fertility treatment, one of the key of, receiving good aftercare after going through IVF, for example, is your fertility specialist giving you an indication as to when it is best for you to perform a pregnancy test. This will be so helpful because you will know to wait and to try to relax, but also it will prevent the anxiety that will be associated with you repeating pregnancy tests and getting multiple negative pregnancy tests just because you are doing it at the wrong time. So back to timing. If you are testing before implantation happens, or even a day or two after implantation is thought to occur, you are very likely to get a false negative test result. And false negative simply means it's a negative test, but it is not truly negative. And the whole reason for that is because the beta-HCG level is just simply not high enough. Reason number 2, diluted urine will lead to a false negative pregnancy test simply because it dilutes down the concentration of the beta-HCG hormone that should be present in the urine. And what really happens when the false negative pregnancy test happens because of diluted urine is that there's usually a threshold beyond which the pregnancy test, particularly if you're using one of the older ones, the cheaper ones. Yes, believe it or not, there is an advantage of buying more expensive ones because they have a better technology and they have a lower threshold for detecting the beta-HCG levels in your urine. So the newer pregnancy tests, they use a technology that allow a pregnancy to be even detected after a week or 2. Particularly with the more conventional style of doing your pregnancy test, the threshold for detecting beta-HCG is probably slightly higher. So if your urine is really diluted, either because you're drinking too much or when you went to the toilet you weren't producing enough urine and so you mixed it with a little bit of water, you are diluting the beta-HCG. So you're making the threshold even more hard for your urine to be able to achieve because you've just diluted the concentration of your beta-HCG. So I've just alluded to how it is that you can get diluted urine. Yes, it's by drinking too much water or taking in too much fluids. So essentially, most of the things that we will consume, whether it be water or tea or coffee, for all of these fluids, the foundational liquid is water. So as you're drinking more fluid, your body will produce more urine in order to be able to get rid of the excess water. This dilutes everything in your urine, including beta-HCG. And so you can imagine very early on in the pregnancy, if you are drinking lots of water and your beta-HCG levels are relatively low in the first place because you are really early on in the pregnancy, and sometimes implantation hasn't even happened, or even if implantation has happened, it's happened within the past day or two, and you have the tiniest amount of beta-HCG, and then you're drinking water and you're diluting your urine, diluting your beta-HCG, of course the test strip is not going to pick up the fact that you are pregnant. Just remember, ladies, a good detection threshold for your pregnancy test, and that's its ability to detect the amount of beta-HCG in your urine. So the lower the threshold, ideally, the better the test is. But on average, you shouldn't be buying a pregnancy test that has a threshold of higher than 20 to 25 milliliters international units per mil. You want at this detection level or lower, but just obviously be aware that the lower the threshold is, the more expensive the test will be. Number 3, testing later on in the day. Yes, would you believe that that is a common reason for getting false negative pregnancy tests, despite having multiple early pregnancy symptoms? This is kind of linked to reason number 2, but this time it is not because you are diluting your urine by drinking too much. Would you believe that later on in the day, say for example in the afternoons, your urine has a tendency of being more diluted in comparison to urine that was produced earlier in the morning? Again, the false negative happens because of the exact same principle as reason number 2. The beta-HCG level that is found in the urine later on in the day, for example in the afternoon or the evening, the beta-HCG in the urine is likely to be more diluted and therefore less detectable by the pregnancy test. And then this is going to be even more likely when you are very early on in the pregnancy and you are not only doing the test too early, but you are also doing the test at the wrong time of the day. So in essence, morning pregnancy tests are the best. Having said that, you can now understand why early morning pregnancy tests are recommended. This is because overnight during your sleep you haven't been drinking, and early in the morning your urine is likely to be more concentrated, and therefore the beta-HCG levels are more likely to be detected in the early morning pregnancy tests. For everything that is functional, there will always be the faulty version. Yes, the 4th reason for false negative pregnancy tests are faulty tests. The reason why faulty tests give a false negative, it's because the antibodies and the chemicals that detect the beta-HCG hormone within the urine degrade over time. The urine pregnancy tests rely on antibodies to bind to the beta-HCG that is found within the urine. And it is this that produces the second visible line that a lot of you ladies watching this video will be looking for, anticipating for, praying for. After the expiration date, these components become less sensitive or just stop working altogether, which means that test might not detect the pregnancy, even if the urinary beta-HCG is at a decent level. And reason number 5 may be the fact that you are not yet pregnant. Note, I said yet. It has not happened for you this time round. And when that's the case, and that usually comes about, and women are usually willing to accept this reason number 5 after they've done multiple tests and they've changed testing brand and they've gone to their doctor and have done blood tests that have shown that they are not pregnant. When that's the case, we need to be looking at other reasons why you are getting all of these pregnancy-like symptoms, but you are not officially pregnant. Believe it or not, there are actual medical conditions that can mimic pregnancy symptoms. These conditions include PCOS, thyroid disease, having uterine fibroids, adenomyosis, or phantom pregnancies. I must also mention molar pregnancies. And let's not forget, if you are really eager to get pregnant, or you are really frightened of getting pregnant, and all that is on your mind 24/7 is the fact that you might be pregnant, you can actually be experiencing symptoms due to your psychological state. So what should you do if you are a woman who has physical symptoms of pregnancy, but you are getting negative pregnancy test results? Number 1, wait a couple of days before you test. And if at all possible, sit tight and wait for 2 good weeks after you have started to experience physical symptoms of pregnancy before you do your first official test. However, if you've not been able to wait and you have already done your pregnancy test and you have had a result that shows that you are not pregnant, the deed is already done. Give it another 2 or 3 days before you test again. Better yet, if this stress, confusion, anxiety, and frustration is really getting to you and you just cannot bear taking another home urine pregnancy test, get right to your doctor and ask your doctor to do a serum. And that means a blood test to check your beta-HCG level. That test, you cannot get it wrong. It's almost impossible to get a false negative blood beta-HCG level. The second thing that you can do is to always perform your home urine pregnancy test early in the morning, because as we have seen, that is when your urine is likely to be most concentrated and the urine beta-HCG most easily detectable at that time of the day. Number 3, avoid drinking large amounts of water before doing your home urine pregnancy test. Number 4, always check the expiration date of your home urine pregnancy test, both on the box and on the outer wrapper of the test itself. Remember to check both of these dates. Number 5, use a sensitive home urine pregnancy test with the threshold that I described earlier on in the pregnancy, or even a lower threshold. The lower the threshold, remember, the better. And finally, talk to your doctor, because as we've seen in this video, there might be other medical reasons why you are getting negative pregnancy tests, but with multiple early pregnancy symptoms. Sometimes it has nothing to do with the pregnancy. Sometimes it's your body telling you that there is something wrong. So those symptoms actually point to a disease rather than to a pregnancy. So do not be overly obsessed with trying to fall pregnant to the extent that you are ignoring the signs that your body is giving you that there may be something wrong. That's it for this video. I hope it's been helpful. I hope it will help a woman know when to test, help her reduce her anxiety related to doing pregnancy tests when she's anticipating a pregnancy, and all of the great stuff that this video might bring to someone out there. Remember to like, share, and subscribe, and remember to check out all of the other content that I have right here on HeyDoc. There are hundreds, literally. So dive into some of the other stuff that we've got right here on HeyDoc. Until I see you again at our next video. Take care, and we'll see you later. Have you subscribed? No? What do you mean no? You are not to be told how much it is of great help to us when you hit that like button, when you share, and also when you subscribe. It helps us to get this evidence-based, reliable medical information to more women and men out there who need this information on their fertility journey. So many thanks in advance for doing all of the above.